Hello everyone, I am your MBBS sub and we go on to the video. Today our topic is Introduction to Pathology. Okay, let's move on to the topic. What is pathology? Patho means suffering and logy means study. It is study of suffering. Pathology is called as study of suffering or study of various diseases. The study of change in a structure and function of body in the disease. So if I have a disease, how our body structure will be there, and how our body function will be there, how our body functions if we got a disease. So it is called as the study of structure and function of the body in the disease is called as pathology or study of diseases. Next, pathophysiology. Pathophysiology is the study of disordered function and breakdown of homeostasis in disease. Okay, 1 minute. Okay, breakdown of homeostasis in disease means it's a biochemical change. Homeostasis means it's a biochemical change in the body. Okay, and disordered function, it's a study of disordered function and breakdown of homeostasis in disease. Homeostasis means what? Biochemical change and disordered functions. Okay, disordered functions, it's a physiological change. In our first year we will read about in physiology we will read about various diseases of various disorders and different kinds of diseases. Okay, so disorder function means physiological changes. Okay, then the father of pathology is Rudolf Karl Virchow. Okay, next, health, a condition when an individual is complete according with the surroundings. Okay, health means what? It is a condition when an individual is complete according with the surroundings. That means individual is complete according with the surroundings. The individual is feeling safe. Okay, he was normal with the surroundings. He was feeling, yeah, I'm okay, I don't have any illness or any weakness or no any other diseases or symptoms. Okay, disease means what? Loss of ease or comfort of the body, means he was losing his comfort. He got illness, become dull, and the disease symptoms will be there. So it is called as a disease. Then we will go about the important terms in pathology. First, there are totally 8 terms. Okay, first, a patient. Who is a patient? A person affected by a disease is called as a patient. Is known as a patient. అంటే ఇప్పుడు ఒక పర్సన్ ఎవరికైతే ఒక డిసీజ్ ఎఫెక్ట్ అయిందో అని ఏమంటాం మనం? పేషెంట్ అని అంటాం అనమాట. సో దెన్ లిసన్, క్యారెక్టరిస్టిక్ చేంజ్ ఇన్ టిష్యూ అండ్ సెల్స్ ప్రొడ్యూస్డ్ బై ది డిసీజ్. characteristic change in tissue and cells produced by disease. It is a change in the cells. Lesion means what? It's a change in the cells produced by disease. It's called as a lesion. And etiology means what? Causal factors responsible for lesions. And what are the factors causing? What are the factors responsible for the lesions is called as etiology. Okay, then pathogenesis means what? It is a mechanism by which lesions are produced. Means how the disease was produced, how was the disease occurred to a particular patient. Okay, is called as pathogenesis. And then diagnosis. Come to the diagnosis. In diagnosis, we will take about the patient history and what was his symptoms, morphological and functional changes, how how he will react to the symptoms, and what was the suffering he has done. Okay, and other investigations of the patient which help for the identification of the disease. Okay, by the history taking, okay, he has certain symptoms. Okay, so he will have some particular disease. By that we can identify the disease. Is called as a diagnosis. Then go to the prognosis. Prognosis means what? It's a prediction of a course, what is going to happen. Okay, what is going to happen if we take a disease or treatment. In a disease, there will be some stages. For cancer, if we take cancer stage 1, stage 2, stage 3. Okay, now he was in a stage 2. What in stage 2, what will becomes, what happens. So it is a prediction. It is called as a prediction. And like that, in a disease, in a treatment and prevention, what is prediction of in these three things is called as a prognosis. Okay, then go to the treatment means what? We all know about the treatment. Means how to cure the patient with drugs. Means how we can cure, what drug should be given to the particular disease, and how we do about that disease, how we cure that disease is called as a treatment. Then prevention means what should be done to avoid complications and spread. Okay, what prevention means what should be done to avoid complications and spread. Okay, we should avoid the complications and we should stop the spreading of the disease. By that we can prevent that particular disease. Then next we go to the subdivisions of pathology. First, morphological branch. There are two types of branches in pathology. First, for morphological branches, and second one, non-morphological branches. First we go to the morphological branches. In morphological branches, there are three branches: histopathology, cytopathology, and hematology. Okay, first we go to the histopathology. In histopathology, there are three things: surgical, experimental, forensic, and autopsy. Okay, in surgical method, tissues are removed. Okay, and then in experimental method, production of the diseases. Okay, in experimental method, it is morphological changes in organism after sacrificing the animal. Okay, What are the morphological changes and production of disease in the experimental animal is called as a it is experimental type pathology. Then forensic and autopsy, the study of organ or tissue removed at post-mortem for medical legal work. If he has taken any drug or any food poisoning, they will remove certain organs or tissues for the lab diagnosis and medical legal work. It's called as a forensic and autopsy pathology. Okay, and then second type, cytopathology. In cytopathology, it is a study of cells shed off from lesions. It is the study of cells shed off from lesions. Means exfoliatocytology, and it is a we will do fine needle aspiration. Okay, so we call this fine needle aspiration cytology for diagnosis. Okay, for deep for deep seated lesions diagnosis. For deep seated lesions diagnosis. Deep seated lesions diagnosis. And then next, hematology. It is a disease of blood and blood forming organs. What are the diseases of blood and blood forming organs? Means, for example, disease of blood, anemia, sickle cell anemia, and so many like that. Okay, and in that, laboratory hematology and clinical hematology. Next, we will move to the next topic, non-morphological branches. In non-morphological branches, there are totally 7 branches. In that, first one, clinical pathology. Clinical pathology. One minute. Clinical pathology. It is analysis of body fluids. Clinical pathology, we will generally do analysis of body fluids like cerebrospinal fluid, urine examination, semen examination, blood examination, uh, for blood sugar level or any presenting ketone bodies or excretion of protein, like that we will find in the clinical pathology. And next, clinical biochemistry. In clinical biochemistry, in first year we will do serum and plasma protein levels, serum levels. So like that, it is clinical biochemistry is about the serum and plasma collection and analysis of that samples. And then medical microbiology. It is medical microbiology is mainly about the disease causing microbes like bacteriology, parasitology, virology, mycology. Okay, and then next, immunology. Immunology, we will generally know about the abnormalities of immune system, like immunology is also called as immunopathology. Immunoglobulins or any active immunity, like any immune deficiencies he, as a certain patient is having, like that. And then medical genetics. Medical genetics means generally human genetics have blood grouping, and then what are the inborn errors like chromosomal downs down syndrome, and then Klinefelters, and then Turner's, like that, inborn errors diseases. And then molecular pathology means what? Detection of the abnormalities at level of DNA of cell for PCR test, for example. And then molecular cytogenetics. It means molecular biology and cytogenetics. For example, cancer. We will know about the different types of the cancer and how was it affecting and what is the molecular basis of the cytogenetics and the cancer. Like that we will find. So this is the topic, guys, for today, and tomorrow we will tell about the microbiology first topic. Okay, guys, see you.